The value of an honest SLP, how to make sure patients like and trust you. Who doesn't want to be trusted? Especially as therapy providers, we have to build rapport and get buy-in from our patients. They're human. If they don't trust you or like your style, then you might find slower progress, or maybe none at all. So let's talk about it and what you can do about it. Let's dive in. I'm Theresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the Med SLP Collective and Med SLP Education. Trust is the antidote to success. The title of this video is a little tricky. Our patients don't need to really like you, but it's important to build a very cordial and trusting rapport. Presenting all of the options instead of passing on our own assumptions is one of the most important things we can do. Our job is to lay out all of the facts of the situation and the options and support the patient as they make the best decision for their own situation. So I have a little story for you. My son needed a new gait trainer and his physical therapist had recommended a very specific one. Another therapist told me that the one they recommended was way too expensive and we would want to consider a different one. I told her that I wanted to pursue it because it was in fact what his PT said would be best. And we'll wait and see what insurance thinks. But she was insistent that it was way too expensive and there was no way insurance would pay for it. She kept telling me that I needed to go back to the PT and have her pick out a cheaper one for my son. I got so frustrated and I told her I was really grateful for her help, but I want to pursue the one that his PT recommended. She said she just didn't understand why we wouldn't want to save the money and go with something else. And quite frankly, I just wanted what was best for my son, to be honest. And it wasn't her business if I wanted to spend the money or not, if it was going to be the best option that my son needed to learn to walk. I tell you this because a few months later, this therapist was assigned to my son and I refused to allow her to come and do the evaluation. I didn't feel like I could trust her to make the best decisions for my son based on our previous interactions that were full of her opinions and her judgments. All that to say, don't push or project your unsolicited advice on others. It certainly isn't the way to gain trust with your patients. Saying "I don't know" is one of the most powerful things you can say as an SLP. And yes, it's totally fine to say it to patients. We get ourselves in trouble when we assume that we know the answers or assume that we know the outcomes our patients are going to achieve. One patient I had, who will forever be one of those patients that you think about often, was probably one of the sickest patients I've ever had the privilege of working with in a skilled nursing setting. He had a really extensive medical history, multiple bouts of head and neck cancer, but cognitively and humorously as sharp as a tack. He would ask me very high-level questions all the time about the prognosis of his cancer, if they'll have to remove more of his larynx, and if he'll ever be able to eat Oreos again. And I probably said "I don't know" to him more than any other patient I've had in my life. I had a great relationship with him, his wife, and his daughter, and his wife said to me countless times, "You're the only person we've worked with that really hasn't promised us anything." I also recently had an experience with my own primary care doctor where we were talking about some issues that I've been having. We went back and forth about all of the different possibilities and options for testing, and she finally said, "You know what, Theresa? I want to send you to my friend who's a specialist in this area." She said, "I don't know a lot about this. I did do my residency in that area, but I've been really out of it for about 10 years, and I want you to work with someone who can really answer all of your questions better than I can and is really kept up to date with the research." And you know what? That made me trust her even more. Of course, she's a wonderful, competent physician, but we can't expect everyone to know everything all the time. And all that matters to me is that she listened, she knew her limitations, and she made other recommendations. She very easily could have said, "No, I don't think you have that condition." But she truly didn't know, and she wasn't an expert in that area. I'll be posting other videos just like this one that you won't want to miss, so make sure to hit that like and subscribe button and turn on the notification bell. Number 3, assuring the patients that it's okay to alter the treatment plan. It's so important for us to remember the patient perspective of the evidence-based triad. I know I would always get so excited from taking a new CEU course and thinking, "Oh my gosh, this is exactly the treatment plan we're going to do with the next patient I have with this condition." But it's so important for us to remember that the course of treatment is not our decision to make alone, it's to make in conjunction with the patient. Our goals may not really matter to them. Their goals matter to them. And if it means that we have to course correct and throw everything out the window that we thought we wanted to do with them, then that might be what we have to do. Facilitate and encourage open dialogue as best as you can. If your patient decides they don't like the current exercise protocol, then present some other options to them. But by allowing for this open dialogue, you are building trust and rapport. And if you are noticing measurable improvement and they aren't, you may encourage the patient to just try to keep going for a few more weeks. This is also where patient-reported outcome measures can be very helpful to help the patient see and track their own progress. If after completion of those, they still aren't satisfied, then allow them to change the treatment plan, but just please allow the plan to be fluid and not completely one-sided. I've got a free gift for you from the Med SLP Collective. We have some amazing done-for-you services inside of the Med SLP Collective, where we have a robust and vibrant community of SLPs and mentors to help you out. To access your free clipboard kit, head over to medslpcollective.com/clipboard. Link will be in the description below.